Today we're talking about how to treat your inflammation and pain after an injury. What does the latest research on anti-inflammatories say? Welcome to the Health How-To channel, where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share your best inflammation and pain relief tips so that we can all benefit in our own personal journey to better health. After you have an injury, like a hamstring pull, should you use ice? Heat? What if it's been a few weeks or months? Are you still using ice? What's the right thing to do? The old model of treating inflammation was to prescribe anti-inflammatories known as NSAIDs, short for non-steroidal anti-inflammatories. Common over-the-counter options are ibuprofen, aspirin, and naproxen. These NSAIDs were taken sometimes for months and years to help relieve pain, especially for chronic conditions like arthritis. The trouble is that NSAIDs can also cause gastrointestinal issues like nausea, indigestion, stomach upset, as well as kidney and heart problems. They're generally not recommended for people with peptic ulcers, high blood pressure, kidney or liver problems, stomach bleeding, pregnancy, people over the age of 65, and or on daily aspirin. Non-steroidal anti-inflammatories work by blocking an enzyme that contributes to inflammation. Note that NSAIDs don't actually stop the source or make you heal faster, but they are meant to help with swelling and pain. Acetaminophen, like Tylenol, can also help reduce pain, but it does not stop the inflammatory process. Let's back up a bit and talk about what inflammation is and why it even happens. After an injury, the body initiates a process where blood vessels dilate to increase the blood flow to the injured area, making your skin look red. Then white blood cells, fluid, and other substances come in to clear the damaged cells, making the area swollen. Sometimes the swelling is so substantial, for example in the knee, that it limits your ability to bend the joint fully. Usually this lasts for 1 to 3 days and is known as short-term or acute inflammation. This inflammatory process is helpful and normal for the body. There's also long-term chronic inflammation, where healing is slow and swelling and pain are persistent. Examples are joint-specific hip arthritis and shoulder tendonitis. Systemic inflammation can also occur where our immune system is always on high alert and in an inflamed state, like rheumatoid arthritis, a systemic autoimmune disease. Chronic systemic inflammation can occur in the brain too, like Alzheimer's and Parkinson's disease. Things that can often worsen existing inflammation include older age, stress, obesity, a diet high in sugar, and trans or saturated fat, like highly processed foods, baked goods, and high alcohol intake, smoking, a sedentary lifestyle, and poor quality sleep. So what is the latest research saying about anti-inflammatories like NSAIDs? Studies in rats showed decreased strength in the healing of cut tendons versus rats who did not have any NSAIDs. The effect was most prominent if NSAIDs were taken from 3 to 12 weeks, but bone healing delay was noticed after as little as 1 week. Of course, these were animal studies. Human studies have shown some mixed results. Some studies have shown a delay in fracture healing, while some studies have shown no statistical difference in whether someone took NSAIDs or not for fractures that didn't heal. In addition to potentially delayed healing and strength of bone, tendons, and muscles, the latest research shows that the use of anti-inflammatory medication could increase the risk of chronic pain. Many doctors just prescribe NSAIDs for 3 to 7 days for new inflammatory pain like tendonitis and bursitis. Some surgeons are starting to not prescribe any anti-inflammatories after ligament repair and bone fixation surgeries. The bottom line for now seems to be that a short-term course of NSAIDs seems generally safe for the first 3 to 7 days after new pain or injury, but you may want to ask your doctor about other analgesic options. As always, you should follow your own health professional's guidance for your personal situation. Let's say you don't like taking too many medications. What else can you do instead for mild to moderate injuries? Before, the common advice was to do a combination of protecting the area, rest, ice, compression, and elevation, known as the PRICE acronym. There is a new, slightly altered concept with the acronym Peace and Love from researchers Dubois and Escalier in 2019. This principle is geared towards allowing the natural short course of inflammation, minimizing pain, and optimal healing for new mild to moderate injuries. Right after a soft tissue injury, like a back strain, ankle twist, or knee sprain, do no harm and use the PEACE principle. P. Protect the area for 1 to 3 days by unloading or restricting your movement. That could mean staying off your feet if you've hurt your knee. It could mean avoiding bending if you've pulled your back muscles. Minimize how much you rest and let pain be your guide. For example, if you've hurt your back, don't lie down all day in bed if you're able to walk a little. Don't keep your arm in a sling if you can comfortably lift your arm to shoulder height. Instead of putting on a collar right after a car accident, stick to comfortable, slow, and small neck movements. E. Elevate the injured limb higher than heart level to help encourage swelling to drain. A. Avoid anti-inflammatory medications and ice as they can slow the growth and repair process. C. Compress a swollen joint like the knee or ankle to help with pain but still allow movement. You can use a tensor wrap or compression sleeve. E. Educate yourself on the process of pain, realistic recovery times, and the benefits of active recovery over passive therapy like massage, laser and ultrasound machines, painkillers, and injections. After the first few days have passed, a soft tissue injury needs some love. L. Load your injured area slowly to promote blood circulation, stimulate the repair and remodeling process, and build strength of the healing tissue. Remember that your body is a living thing and it will respond to progressive, moderate stimulation. The act of contracting your muscles releases proteins that start to reduce the inflammatory process. The reverse is also true. The body does not want to waste its energy to maintain something you never use. O. Optimism. I really like this new addition to the previous model because it's truly the first time the brain and our thought process are considered an integral step to recovery. Now, no one is saying you have to grin and bear it or pretend that you're fine when you're not. What you want to limit is going down the rabbit hole of what if thinking, where fear, anger, and grief consume your entire existence. Don't jump to conclusions if you've been told that you have degenerative disc disease and resolve yourself to having a permanent disability. That's simply not true. Nobody can predict that. Studies suggest that being pessimistic about your injury and recovery can affect your outcome. Watch our video on how to be positive when you're sick and some of our other stress and anxiety videos for some tips. V equals vascularization. Healing needs good blood flow. Find pain-free exercises that elevate your heart rate for at least 10 minutes to get a small cardiovascular workout. Most people find that a brisk walk is the easiest to do. But if you've injured your leg, you can consider biking, swimming, or some upper body boxing type moves. E equals exercise. The last important concept is to exercise, but think of it as targeted movements to improve flexibility, strength, and body awareness. If you've hurt your shoulder, start doing simple shoulder rolls and wall stretches, followed by light weights in a pain-free range. Be mindful of your posture and avoid that protective, scrunched up position by opening up the chest and doing some deep breathing all the way down to your belly. We have lots of videos on different types of injuries and how to get better step by step. If you're really interested in natural remedies, you can try growing your own natural medicinal garden. Click on the affiliate link in the channel description to get a medicinal garden kit. This kit contains a variety of seeds for you to grow plants with highly beneficial properties for reducing inflammation and promoting overall health. Seed packets included in the kit are the marshmallow plant to help with digestive issues like Crohn's and irritable bowel syndrome, evening primrose to balance out hormonal related issues like weight gain and fatigue, and echinacea to support your immune system. The kit comes with an instruction book that guides you on how to make your own remedies from the plants you've grown in your own backyard. By growing your own natural medicinal garden, you always have access to fresh and sustainable sources of plants and herbs. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.